I am. Thanks, Chair. And thanks to the witnesses. Really enjoyed the interaction, and good to see Irene and Moyena again. And thanks for giving me a crash course last time that I met you guys. And Vanessa, it's okay. I still get nervous every time I have to speak as well. So it's good to name that. That's what I always name it myself as well. So listen, there's a couple of things that hasn't been touched on that I wouldn't mind touching on a little bit, if you don't mind. So I kind of two questions, Chair, and I'll ask the both of them, and then I'll leave time for witnesses then to come in. You mentioned, Moyena, in relation to the amending the Mental Health Act for under 18s to be able to access mental health services. At the moment, we have a bill in the Bill's office at the moment, the capacity to consent, which will allow 16 and 17-year-olds to be able to have more autonomy, to be able to have a right to choose in their mental health treatment, on parity what they would have if they had with their physical health treatment as well, because they have a more say in your physical health treatment. And one of the reasons that this bill was being introduced, and we can amend the Act, is in relation to the parental barriers sometimes, and some of the barriers that was preventing people from accessing mental health supports and disclosing why they were accessing the mental health supports, and also in particular treatments that they were looking to access as well. And I'd say this is even more problematic for young people in the LGBTI community, especially around some of the parental barriers that may be there. So, the first question I ask, because we didn't get into them in your statements, if you could elaborate a little bit on why this is so important to young people that you represent.
I'm happy to come in first, but sure, I know both my colleagues Sinead and Erin have been working on the conversion therapy, and Erin's been working on this issue in North America as well as over here. So we'll have very interesting insights. But just in relation to the Mental Health Act, Deputy and committee members, yeah, you're absolutely right. For some LGBT young people who aren't out, or who are out but don't have parental support at home, accessing mental health care is impossible, because if they can't get their parents to consent to it without outing themselves or putting themselves in danger because they're accessing it around maybe conflict that's happening at home because of their sexual orientation or gender identity. So absolutely, we've been advocating for to level out access to mental health care to 16, the same as it is for other medical health care. And we also would advocate for the introduction of the Gillick principle. So this is a judge-made law from our principle from the UK that arose out of a young woman under 17 looking for access to contraception. So in the UK, a medical professional can make a decision based on their assessment of the young person that they're working with to see if they have the competency, if they have the capacity to consent themselves, and where they do, then the medical professional is covered, I suppose, to provide them with the healthcare that they require. And we're strongly advocating that a similar principle be applied here in Ireland. Funnily enough, the Mental Health Act also works in reverse, so it will affect conversion therapy as well, because not only are young people not allowed consent for medical health care under 18 without parental consent, neither can they refuse it. So this is, again, the conversion therapy, because it's very much couched under psychological or counselling. They can't refuse it because if their parents send them for it. And I'm going to hand over to my colleagues Sinead and Erin, who could talk to you a bit more about about conversion therapy and how it in reality is happening today in Ireland.
Thank you.